Welcome back. Now, South Africa joins other countries in observing World AIDS Day today. The infection rate is said to be on the increase in the country. Now, let's cross now to Xikundu in Limpopo province, where our reporter Lutendo Bobodi is, and he is with a video journalist, Hulisani Ravele, and they are standing by there to give us a sense of what's happening. Lutendo, good morning. So we know the Deputy President is in Limpopo, of course, on this awareness drive. Please tell us what's in store for us. What activities are you attending at Xikundu this morning?
Yeah, thank you so much, Sakina. Firstly, you don't even need a weatherman to tell you how the weather is. Just look at my forehead. It's scorching hot here, 28 degrees Celsius, and it's only just after 8 o'clock in the morning. But of course, as you said, all systems go here in Xikundu, just outside Malamulele, where the Deputy President of the country, Mr. David Mabuza, will be here just sort of commemorating the World AIDS Day. A very a vital fixture in our calendar, not just locally but also across the globe, where we have a thought about people that are living with HIV, and also some sort of commemoration, those who have died from the HIV-related illnesses. Of course, the program here was supposed to start at least at 10 o'clock, but it seems there's going to be some delay here. As I can tell you now, they're still putting up some tent. But of course, people who will be coming here, as you can see just behind me, people are trickling in, and it seems that it's going to be a long day. But of course, as I said earlier, all systems go. This theme this year is married to COVID-19, understandably so. We've been speaking to a whole lot of structures and stakeholders, your health authorities, your NPOs, your patients who've been telling us about how the HIV program has been disrupted this year due to COVID-19. We see people not visiting health facilities in fear of HIV. We see some of the bedridden patients closing their doors in the faces of those who bring care to them. They are the home-based care workers in fear of COVID-19. As I said, understandably so, this year we cannot divorce this theme of World AIDS Day from COVID-19. And now I'm being joined here by MEC for Health in Limpopo, Dr. Popirama Tuba. We'll be talking about firstly, the HIV program here in Limpopo. MEC, thank you so much for your time. Thank you so much for your patience. Let's talk about the HIV program in Limpopo. We understand that COVID-19 has disrupted the program. I heard you this morning on radio talking about how the PrEP's tablet is expiring in shelves. Talk to us about it.
What we indicating is that as a result of COVID-19, we saw a slow, and I mean, if prior COVID-19, in terms of our 1990, we were really far ahead. What we are comfortable with currently is that the first 90, we've been able to catch up. As we speak, 94% of those that we were supposed to target to know their status, we have been able to reach out to. But the second 90%, we have regressed to 64%. And also the third 90, at least we are picking up, we are back to 87%, which is where the 90% of those who are on ARVs must get their viral loads suppressed. The initiation of those who are positive, that's the one which is the second one, which has been slow. So what we have done is that let's learn from how we tackled COVID-19 pandemic to say every patient who is on ARVs, we must do contact tracing and follow up. The community health care workers now, they've been given a package where they are able to test you for malaria, test you for HIV, AIDS, screen you for TB, some even screen you for blood pressure and the blood sugar, so that we holistically and integrate all these diseases within the same program. So in that way, that's how we are picking up to where COVID-19 has really regressed us.
Okay, you spoke about tracing. One of the challenges is that the undocumented foreign nationals that test positive for HIV are very hard to trace because they always change their addresses. It's not just a problem in Limpopo, also across South Africa. What do you say to that?
That's a serious challenge for us. Hence, you will know we target sectors where this foreign you will find workers you'll find them. That is why we are now working closely with the farming community and also the farm owners so that they are free. They shouldn't be running away from us. Yes, they can run away from Home Affairs and from police for being illegal. But in terms of the public health, they can't run away from us. We have got to trace them and be able to give them ARV. So most of the farmers, especially if you go around Madimbo, the Musina area, the farm owners there, we even have got they've even given space in their farms where we will come and distribute the ARVs. At the same time, that's how we were even able to vaccinate. But of course, with the vaccination, it's only those with passports that we were able to. Hence, our appeal to the National Department of Health and Home Affairs to say, how can we come up with a way on vaccinating them? Because the public must understand, as much as we're saying only those who are legal must be in the country, it also pains us as health when you've got so many illegal people, because they are also draining on our very same fiscus, which we do not even have the money. There has been the budget cut. But however, we cannot say we are not going to vaccinate them because they are not South African. No, we are not going to give them ARVs because they are not South Africans or they are illegal here. The bottom line is that these are infectious disease which does not care about your border, and anyone who is in the country must be vaccinated to protect the remaining citizen. If we put you on ARVs and your viral load is suppressed, it's undetectable, it's not easy to infect the next person, even if you are not condomizing. I'm not saying people mustn't condomize, but I'm just saying it reduces the risk of spreading the very same virus.
Thank you so much for your time. Yeah, thank you so much, Sakina. Yes, the Deputy President we hear is here. He's visiting the royal family as a procedure, just to take a knee and say hello to the local chief here. Later on, I want to talk to you about the number of children that are living with HIV. Sakina.
Well, Lutendo, try and get some shelter there because, yeah, we don't want to lose you to heat stroke or anything like that. As you can see, they're very hot out in Xikundu. And Lutendo Bobodi, our reporter, following the developments there with the Deputy President expected to make an appearance. As you heard there in his discussion with the Limpopo MEC, you know, there's a lot that needs to be done still. But, of course, the authorities working as hard as they can, trying to convince people to do what is the right thing in order to try and stem the tide, not just with COVID, but also with HIV and AIDS, given that today is World AIDS Day. Right, with that, we're going to take